Running an ambulatory practice today isn't simple. Leaders are balancing patient care, staffing pressures, financial performance, and rapidly changing technology all at once.
Welcome to In Practice, a podcast focused on the latest in ambulatory care, what works, and what leaders need to know to help their practices thrive.
Hi, I'm Jenna Hagan, Vice President of National Revenue Cycle Management Sales here at NextGen Healthcare. And this is In Practice, a podcast where health tech leaders, clinicians, and administrators talk about real operational challenges facing ambulatory care and the strategies that help teams overcome them. And today, I am joined by Carmen Lovato with Kewa Pueblo Health Corporation, a healthcare leader with deep hands-on revenue cycle operations experience. We're going to talk today about how embedding rules engines and automation can really help healthcare organizations, especially tribal health organizations, improve claim accuracy, reduce bottlenecks, and create more control over revenue cycle. Carmen, welcome to the show. Thank you for joining today.
Hi, thank you for having me.
Absolutely. Glad to have you. Well, let's just kick it off. Tell me a little bit about yourself and your organization, the population that you serve.
My name's Carmen Lovato. I'm actually the clinical informatics for Santo Domingo Health Center. And we've had, and over the last, I don't know, 5 years or so, have helped oversee the business office and help implement some of their um, needs to streamline their billing cycle information and stuff. We are a 638 tribal organization, and so we serve primarily Kewa Pueblo patients, but we also serve the surrounding communities, tribes. And so New Mexico has 9 large tribes, and 4 of them are close to where we are. So we see a lot of them.
That's awesome. That's incredible. What are some of the biggest challenges that you guys were experiencing that made you look to improve your technology or drive more automation and embed some of the rules engines that we're about to talk about?
We have a lot of patients that come and see providers, multiple providers in one day, or have multiple visits in one day. So we run into a lot of duplicate encounters. And our state, we're only able to bill with our state rules for our Medicaid OMB reimbursement. We're only able to bill for one visit per location. So we were running into errors where we were billing multiple claims or multiple encounters for visits when patients had multiple visits in the same day. We were running into issues where we were getting denials because the wrong insurance was attached to the encounter, or there was no insurance attached to it when there should have been insurance attached to it. So we were really looking for ways to help streamline that and reduce our number of denials that we were getting through our claims.
Yeah, it sounds like a lot of manual touch work too, right? Of just your staff time to catch it from an eligibility perspective, making sure an insurance is on file, the multiple encounters or appointments, dates of service.
Right, and there was, and we had, some of our billing staff were going down and working a whole patient's chart instead of trying to get, back claims out, so then it was taking longer time to get, our older claims out the door because sometimes those were getting missed if we were just working one patient's chart instead of, like, a regular coding queue.
Yeah, absolutely. Talk to me a little bit about or a little more specifics around the before and after, right? So we hit upon like the manual work and sometimes just missing information based on the patients coming in for different types of care to different providers and not realizing what you need as an organization unless you ask for it or put it on file. But what does that after look like in that transformation for you guys?
So it really helped us, especially with our specialty providers, because it was really each specialty has its own coding set of coding rules for it, and it reduced the time that our coders had to go out and look up those coding rules to make sure that everything was coded right. They could just log into RCX rules, look at it, see what was hitting and what modifiers needed to be added, or if there were anything that was missing from it, if the diagnoses needed to be reordered. they're able to do that right in one spot instead of having to go all over the place and try and figure it out and fix it, or looking through their coding books. It was already there for them.
Yeah, and I grin a little bit because, it brings back, some of the troubles and pain points I had at an organization that I ran before working for NextGen of having those Excel spreadsheets and those books. When you say a book, it's literally a book, and there's literally printed papers and all the manuals of all the guidelines and everything to follow to know when to, add the modifiers or reorder the codes appropriately or what you can and cannot bill. Um, were you able to use a balance between standard rules already built and customized rules, or did you have to customize some rules? What did that experience look like?
So we did. We originally we went through the standard rules that were already there, and we picked out all our specialties and reviewed them. And that was a nice thing. We got to pick if we wanted it or not wanted it, to turn it on or not. Um, and we used a lot of them, especially for our specialties, like I said. And then we did custom build rules for us. Um, we did the one for the duplicate encounters, so it would tell us if a patient had multiple encounters for one location. We did another custom rule to tell us if our specialty providers that came in, if they were requiring a referring provider on the claim or not. We also did another one because initially, as a tribal health organization, we wanted everybody to be able, if they didn't have insurance, we created a dummy insurance called IHS eligible. So it would just write off their claims and adjust it for us. So we didn't have to worry about those ones. But then we created the custom rule because we found that some of our patients actually had insurance and they just ordered it wrong, or they just attached the IHS eligible and didn't add any insurance to us. So for them, so we created a custom rule that let us know if a patient had IHS eligibility insurance attached to it, just so that we could go and just look at it real quick, make sure that it was right, and if it was fine, then you would be able to override that rule and it would pass through RCX.
Yeah, yeah, that's incredible. So you guys have a true balance of standard use between your specialty mixes. You were able to customize to your organization based on some of the challenges or pain points, some because of patient population, some because of staff and just the manual work, right, that it takes to go through every encounter. But also, too, you've leveraged this automation and embedding this in your workflow to not just automatically fix everything for you, but you've also created a little bit of a review queue of some of those customizations and unique needs for your organization versus having to just reactively go and check every single encounter.
Correct, and it was helpful. We didn't have to go and check every encounter. If the encounter went through and it's clean, then it goes straight through RCX rules. It doesn't have hit any edits or
Yep.
anything. And then we're able to build those ones out sooner. And then my team actually works the coding queue on a regular daily basis. And then they'll go through at the end of the evening and bill out those claims that they've worked.
Yep. So the working by
Right.
exception, so touching a percentage of them. Most organizations average around 25% that they have to touch or still touch just based on some of those unique needs or rules. So the rules engine is generally resolving and automatically fixing around 75% of the claims for an organization. Talk to me a little bit about the impact of the rules engine for you all. I heard a little bit about claim speed there,
Right.
speed to impact and helping to avoid timely filing.
Yeah, so originally, we were really behind on our timely filing and, like, months behind on processing claims and getting them out the door. When we implemented our CX rules and then really got our team into it and using it on a regular basis, we're now processing and sending out claims a month. So we're looking at 30 days from the time they have the data service to the time our claim goes out the door, which is a vast improvement for us as a tribal health organization.
Especially with the unique needs, right? The unique patient population mix and the type of care that you're providing and just the care plan as a whole, right? The
Right.
multiple service lines and how routine they come in for care. So absolutely. From a staffing perspective, I think there's just such an important nuance here that we're talking about for organizations. Like it's one thing to have a rule and tell staff, hey, you're missing a modifier, so that the staff can go manually add a modifier. But what we're talking about is what I like to call stop and swap, right? So the system will catch it. It will automatically add that modifier, or it'll automatically fix, alert you with date frames, especially in global periods, or same day multiple encounters, can't bill for multiple services. But it'll also automatically help to order your E&M codes or your service lines. It'll help to make sure if there is a need for an authorization on file that it is attached and appropriated. And so I just want to hone in a little bit on that automation piece because it's important, right? It's not just
Right.
automatically telling you that it needs something, it's also automatically resolving and helping it go through the system without a human having to
Having to
touch.
touch it. Right.
Yep.
We have some of the automation turned on, and that's the nice thing is you were able to pick what automation parts you wanted turned on and which parts you didn't. And so that has helped us so that our team, like, if they needed to, again, like you said, reorder the E&M coding, we have that turned on, so it'll just fix those for us. Um, it will reorder the diagnoses automatically for us if it just needs to be reordered. And then if it doesn't and it's still missing diagnoses, then that's where it hits that claim stop and, we'll
Yep.
manually fix it. So those have helped with the automation part, so then our team doesn't have to touch all of those claims all the time. And
Yeah,
and it
absolutely.
helps too because your providers don't always pay attention about which one they need to have first or not. They're just busy trying to treat patients.
Provide care, right?
Right.
Yeah. Yeah. They're not coders, they're not billers, and they don't want to be,
No,
right? It's hard enough keeping up with payers and what you can or can't do. But yeah, they're focused on patient care. So this allows them to provide that care. It allows the system to help recommend what it should recommend. But there's a backstop. There's what I like to call a line of defense to help automatically correct what it can and should.
correct.
Awesome. Talk to me a little bit about how being able to embed this into the workflow has changed your team's confidence and efficiency.
Right, so they've been able to, like I said, now they don't have to go and look at all the books and
Mhm.
look up that stuff, and it's been a lot more helpful for them instead of having to memorize or have all the spreadsheets or things, especially for all our multi-specialties that come in. Because I have specialty providers that only come in, like, once a month. And
Mhm.
so that, maybe they'll see 5, 10 claims for them in that month, and then they don't see them again and they get swamped with everybody else. And so that has been nice to have that. And they have the confidence in the system that we've, picked out the right custom rules for it or the standard rules. And the system helps them and guides them through those our subspecialties with their coding exceptions.
That's awesome. It's really great to hear about your organization's success, right? Embedding this tool, helping to give automation, give your team confidence, but also give them time to work by exception. Healthcare is healthcare. It's challenging, keeping up with all the requirements of what you can and can't do. And so being able to help them work by exception and not have to touch everything is a great win. When we're looking ahead, if there's an organization like yourselves listening to this and have been hesitant to consider or adopt automation, or they don't know where to start, what do you think matters most to helping tribal health organizations to improve their financial performance? And, what would be a piece of advice to help them get over that overwhelming concern to adopt a piece of technology like this?
Right. So I think our biggest hurdle was understanding what our state requirements were to be able to get our OMB rates back, um, and make sure that those are going out because I have one Medicare payer that would be able to allow us that and has certain rules and guidelines for that. Um, so it was really helpful for us to automate some of that stuff and bring in some extra tools to help us really guide us through what our individual payer needs are, make sure that we're meeting those needs. If I was going to give any advice out to another tribal health organization, I'd reach out and, look at your points. What is your state requiring you to have for your specialties or to requiring you to have for your OMB rate? Is everything back paid with that? Or is it not? We really looked at all of that stuff, And it really helped us. And then we just kind of guidelined out what our biggest pain points were. And when we met with our CX team, they gave us that wonderful spreadsheet with all the standard rules. And we went through it and we met with them. And then we told them what our pain points were. And they helped us build our custom rules. And then you test it
Yeah.
out. We were able to test it and make sure it was working fine, and then, adjust it or modify it as we needed.
Yep. So don't have a fear of the unknown, right? You may not know what you need, but there's teams to work with you and help you set them up and work through the guidance of automation that can be best for the organization. And it's iterative, right? Right? You can have it work for 30 days or so. You can do a look back and see what it automated, what it didn't, and you can always add in new rules or tweak the rules to help continue to improve the process. So really great advice. Well, Carmen, thank you so much for joining us today and sharing those practical insights. It was really great to hear about your success and how embedding that automation can really drive efficiency for your staff, but also performance for your organization. Listeners, thank you for making the time for today's episode of In Practice. Be sure to subscribe on Apple Podcasts or Spotify so that you never miss an episode. And until next time.